Good morning, my lovely people. Let me start by welcoming you back to my YouTube channel once again, whereby we always enjoy educational bangers each and every day. And we are still talking about kidney failure, which has been one of the longest topics we have ever discussed. And we are still winding up this topic. But before I continue, if you are there and you are watching this channel for the first time, click the subscription button. Make sure you put the notification bell on so that whenever I upload a video or I produce a video like this, YouTube will automatically notify you and you'll never miss any of our videos. For the returning subscribers, I always appreciate you people because I'm where I am because of your support. So let's continue sharing our videos, liking, so that this channel may grow to greater heights. If you have given your topic and it has not yet been discussed, don't be discouraged because sooner than later it will be discussed. Test results and follow-ups. We discussed how to diagnose kidney failure. We started about chronic kidney failure. And now we are looking about testing results and follow-ups. The results of your examination, or what you come up with after doing a physical examination, will help the doctor make a diagnosis. The results of your examination will help the doctor make a diagnosis and also can help determine the cause of your kidney failure. If you receive a diagnosis of chronic kidney failure, you will likely need regular blood tests. The results of your examination will help the doctor make a diagnosis and also can help determine the cause of your kidney failure. If you receive a diagnosis of chronic kidney failure, you will likely need regular blood tests. These measure various substances in your body such as calcium, potassium, cholesterol, sodium, magnesium, phosphorus. If you receive a diagnosis of chronic kidney failure, you will likely need regular blood tests, or the doctor will be doing you regular blood tests to make sure that he or she at least maintains some functioning of the kidneys. These measure various substances in your body such as calcium, potassium, cholesterol, sodium and magnesium, and phosphorus. The doctor will be able to determine when these are going up or when they are decreasing. You may also need ongoing kidney function tests to measure your creatinine and urea levels. Remember we said during this topic that urea and creatinine are always eliminated by the kidneys. The kidneys are the filtering system of your bloodstream. Sorry. So, if the kidneys are not functioning well, there will be accumulation of creatinine and urea in blood, which are poisonous to your blood. Let's talk about treatment of chronic kidney failure. How will you treat chronic kidney failure? Chronic is whereby it comes over a long period of time. Maybe you have been sick for long and the sickness has affected the kidneys for quite a while. That is what we call chronic. Treatment of chronic kidney failure. There is no cure for chronic kidney failure. Get this clearly, that there is no cure for chronic kidney failure because the kidneys have failed completely. There is no cure for chronic kidney failure. However, certain measures can slow its progression. You just aim at slowing the progression of the kidney damage. There is no cure for chronic kidney failure. However, certain measures can slow its progression. So let nobody lie to you that he or she is going to treat your chronic kidney failure and it will go away for good. The aim is always slowing its progression or the rate at which the kidneys are deteriorating or losing function. Medication. Medication can help treat the symptoms of chronic kidney failure. Medication can help treat the symptoms of chronic kidney failure. So it's hard to treat the original disease, but you can deal with the symptoms. Medication can help treat the symptoms of chronic kidney failure. Kidney failure is linked to high blood pressure. Kidney failure is linked to high blood pressure. Remember, we have said that medication can help treat the symptoms of chronic kidney failure, and kidney failure is linked to high blood pressure. That means if you are having high blood pressure, you are at risk of developing chronic kidney failure, especially if you have been having this condition for quite a while. Most of the people realize that they have high blood pressure at later stages or when the damage has already been done. That's why I always advise people to be having regular checkups for high blood pressure, glucose levels, so that you may know what is happening to your body, to avoid instances whereby you'll just wake up one day and find that the damage has already been done on your kidneys, especially when you are having diabetes and high blood pressure, because we said these are the main causes of kidney disease and kidney failure. So, kidney failure is linked to high blood pressure. So, a doctor may prescribe medication to lower blood pressure. Definitely, the blood pressure has to be lowered. So, kidney failure is linked to high blood pressure. So, a doctor may prescribe medication to lower blood pressure. You might also need medications called statins. We talked about statins. You may need medication called statins to lower cholesterol levels. A doctor may prescribe medication to lower blood pressure, and you may also need medications called statins to lower cholesterol levels. People with chronic kidney failure may also experience anemia or low blood count. People with chronic kidney failure may also experience anemia. Anemia occurs when your body doesn't produce enough red blood cells. Anemia occurs when your blood doesn't produce enough red blood cells. Treatments for anemia include the following: supplement to increase red blood cell production, iron pills or shots to help your body manufacture blood cells, Blood transfusion to improve red blood cell health in some cases. Treatments for anemia include number 1, supplements to increase red blood cell production. Number 2, iron pills or shots to help your body manufacture blood cells. And number 3, blood transfusion to improve red blood cell health in some cases. A point to note, if your kidney problem causes fluid retention, diuretics can help relieve your swelling and it makes you urinate frequently. Let me repeat this. If your kidney problem causes fluid retention, diuretics can help relieve your swelling and it makes you urinate frequently. An example of diuretics is what we call Lasix, which is very much common. Remember, kidneys help in balancing water levels in your systems. So when the kidneys are failing, it may lead to fluid retention in your body. So you may need these diuretics to assist in eliminating the excess fluids from your system because the ankles may start swelling. This marks the end of our video today. Thank you for those who are following me. Thank you for the subscriptions. Let's continue subscribing, liking, and sharing our videos so that we may reach as many people as possible. Let's have a blessed day ahead.